Hello, and welcome to Part 1 of the Learning, Leadership, and Professionalism module of Nursing Experts, Translating the Evidence. Our objectives for this lecture are to provide an introduction to leadership styles, discuss the behaviors and actions of successful public health leaders, review the opportunities associated with professional organizations, and to briefly discuss formalized continuing education and certifications. There are several different leadership styles in public health professional management, each with benefits and detractors in their use and effectiveness towards achieving organizational goals. As a public health professional leader, it is important to have a comprehensive understanding of these styles and then to determine how your strengths and weaknesses fit into each of these categories so that you might focus your efforts on improving your present skills and abilities. Coined by Robert K. Greenleaf in 1970, the term servant leadership refers to leaders who influence and motivate others by building relationships and developing the skills of individual team members. Servant leadership in the public health professional implies that a leader naturally cares about ensuring each team member has the resources and tools they need to succeed. Per Franzen, characteristic skills of a servant leader include listening, acceptance, awareness, persuasion, foresight, commitment to the growth of others, and building community within the organization. Transformational leadership is a management style that motivates employees to take ownership for their roles and perform beyond expectations. It is based on building relationships and motivating staff members through a shared vision and mission. Transformational leaders typically have a charisma to communicate vision, confidence to act in a way that inspires others, staff respect and loyalty from letting the team know they are important. They excel at conflict resolution and are masters at helping people do the things they weren't sure they could do by giving encouragement and praise. Democratic leaders encourage open communication and staff participation in decisions. Democratic leadership in the public health professional can work well to ensure the team feels valued and comfortable speaking up. Workers are given responsibility, accountability, and feedback regarding their performance. Relationships are important to this leader who places a focus on quality improvement of systems and processes rather than on mistakes of individual team members. The authoritarian or autocratic leadership style is demonstrated when a leader makes all decisions without considering input from staff. Negative reinforcement and punishment are often used to enforce rules. Because knowledge is seen as power, critical information may be withheld from the team. Mistakes are not tolerated and blame is placed on individuals rather than on faulty processes. The positive side of this style is that it works perfectly in emergencies or chaotic situations where there is little time for discussion. It is useful when enforcing policies and procedures that protect resident health and safety, but it does not promote trust, communication, or teamwork when used for day-to-day operations. Authoritarian leaders are often micromanagers. Autocratic leadership in public health professionals can be effective in making quick decisions during emergency situations. Conversely, laissez-faire leadership is a style in which the leader provides little or no direction or supervision and prefers to take a hands-off approach. The information presented is informative and does not constitute direct, legal, or regulatory advice. Decisions are not made, changes rarely occur, and quality improvement is typically reactive and not proactive. It is most often used by new, inexperienced leaders or those at the end of their career who choose not to address issues, since things will soon change by their replacement leader. Public health professionals practice in a turbulent, ever-evolving healthcare environment. In order to meet today's challenges and opportunities while strategically planning for the future, it is crucial that we expand our knowledge base and utilization of evidence-based practice principles. Interdisciplinary strategies, including collaboration, communication, and strategically driven partnerships, are an essential component to assuring we can effectively meet these demands. According to Marcia Hughes Reese, one way to facilitate interprofessional collaboration and accelerate the change process is to identify your stakeholders at the very beginning and develop action steps to ensure their commitment to achieving the goal. Suggestions for stakeholder commitment mapping include brainstorming when stakeholders should be included as part of the change initiative or could be impacted by the change initiative, Identify the current commitment of an individual or group to the change initiative, and then develop action strategies to move that individual or group from its current level of commitment to your desired level of commitment. If you know that you already have some members of a group who support the change initiative, enlist their help in developing strategies to target their colleagues. Determine the critical mass of individuals or groups that you believe is needed to align with the change agenda to ensure success. Collaboration is a cornerstone of public health intervention, and public health professionals can model the way for other public health professionals and student public health professionals. Academic practice partnerships positively impact patient outcomes, patient satisfaction with care services, public health professional outcomes, and student learners. These partnerships provide a formalized means for academic partners to share educational resources with healthcare institutions towards translating evidence-based practice principles to improve clinical decision-making, increase knowledge of evidence-based practice, and inspire the growth of evidence-based practice population health initiatives. Student learners immersed in evidence-based practice and academic practice partnership settings become experienced in analysis and the translation of knowledge while growing their ability to become skilled, compassionate caregivers and attentive patient advocates. In a study conducted by Beal, administrators, educators, and researchers agreed that an effective partnership requires shared vision, decision-making, mutual investment, common goals, and must be based on mutual trust and respect. Further, the authors found that personal relationships, open and free communication, and frequent contact and engagement were the foundation of successful academic practice partnerships. Further, academic practice partnerships serve as a unique strategy to reduce public health professional shortages among participating healthcare facilities. According to Franzen, a team is not just a group of people who are directed by one leader. Every person on the team has a role to play, and these combined roles contribute to the overall big picture. It is the responsibility of the public health professional leader to help others grasp the big picture by continually keeping in the forefront a vision of where the team needs to go. The social process by which people interact and behave in a group environment is called group dynamics. It involves the influence of personality, power, and behavior on the group. Narazo and Strabosco describe the two most common roles affecting a group's effectiveness are the person who dominates and the person who remains silent. It can be as difficult to get the quiet person to speak as it can be to get the talkative person to talk less. Please read Group Dynamics and Team Building for detailed information on establishing group roles, problem solving, team building, and development. Foundational to the work of the public health profession is the belief that all persons have equitable and just opportunities which allow them to fulfill their full health potential. However, this can only be realized through a strong public health system with capacity to support equitable health outcomes, regardless of the social drivers of health barriers. This difficult work calls for the development of an extremely competent workforce, uniquely focused on health equity. Over the past decade, individuals have exited the field of public health at alarming rates, as the field itself has changed, expanding and extending as a result of the COVID pandemic. Mentorship is key to help strengthen the field of public health through recruitment, retention, and growth of committed professionals. Mentoring is a reciprocal and collaborative learning relationship between two, sometimes more, individuals with mutual goals and shared accountability for the outcomes and successes of the relationship. Specifically, mentoring can foster the leadership skills that public health professionals need to secure larger roles in developing, designing, and delivering on equitable health outcomes for their community. Mentoring relationships inside healthcare organizations and academic institutions can help those organizations retain public health professionals and public health professional educators, reducing the cost of turnover while also building a professional network. Mentoring can also help diversify the workforce by focusing on recruitment of those historically underrepresented in public health. This diversification can lead to fewer health disparities within the population by providing a workforce that more closely mirrors the population it intends to serve. Though the field of public health has evolved greatly over the last decade, the Council on Linkages between Academia and Public Health Practice espouses 8 domains of competency which apply across the public health workforce and public health settings of practice, education, and research. The 8th domain is leadership and systems thinking and is shown on this slide. These competencies demonstrate how the role of the public health workforce is asked to take a lead in protecting community health, but also must provide insightful evidence-based analysis that can link public health information with clinical operations and data, while also designing scalable public health interventions, thus aligning clinical services with public health interventions in a way that changes a population's health. This is a large challenge, but an exciting, holistic way of impacting community health through true integrated leadership. Next, we are going to discuss the importance of participating in public health professional associations. Why join a public health professional association? What advantages can be derived relative to the cost of membership? Professional development is a vital phase of lifelong learning in which public health professionals engage with other like-minded professionals to develop and maintain competence, enhance best practice in public health, and support achievement of career goals. Membership in professional organizations can bring you together with practitioners and researchers across the world. Conventions, conferences, webinars, websites, committee meetings, mailings, social media, podcasts, journals, chats, forums, and newsletters are all ways to engage and network with peers across the country and the globe. Through these activities, you can broaden your understanding of evidence-based practice applications and scholarship in your field of interest to benefit your agency, your community, and the patients and clients you care for. Some associations to consider are listed on this slide. In addition, many organizations have state or region chapters that you can join. As these organizations want to engage early career learners, there are often discounted rates for students, including opportunities to present at regional and national conferences. The American Public Health Association, for example, has a student section and offers scholarships, internships, and fellowships. Many specialty certification boards require you to take continuing education courses to stay up to date in your practice. Professional organizations offer these CE activities to members at reduced prices to meet these requirements. The National Board of Public Health Examiners credentials public health leaders. Becoming certified in public health is the mark of a public health professional. The domain areas for certification in public health include evidence-based approaches to public health, communication, leadership, laws and ethics, public health biology and human disease risk, program planning and evaluation, program management, policy and public health, health equity and social justice, collaboration and partnership. Some professional organizations also offer discounts to certification review materials, public health professional products and services, auto, life, and professional liability insurance, and may feature special financing offers. Many public health professional organizations offer members an official journal that may contain peer-reviewed clinical articles and research relevant to their specialty practice. These associations also offer career advice and job opening platforms. Certification in public health disciplines require a time commitment. Once you have that exceptional feeling of accomplishment with the certification in hand, it will all be worth it. Certification in your specialty demonstrates that a public health professional has the knowledge and skills to take a lead in promoting health equity. Certification is one way the profession demonstrates a commitment to protect and promote the health of all people in all communities. Thank you for listening to part 1 of the Learning, Leadership, and Professionalism module of Nursing Experts Translating the Evidence. Please refer to our references for more information. This program is being funded by Region 6 of the network of the National Library of Medicine, whose mission is to provide U.S. researchers, health professionals, public health workforce, educators, and the public with equal access to biomedical and health information resources and data. It is supported by the National Library of Medicine, National Institutes of Health under Cooperative Agreement number UG4 LM 013729.